talking about chronic kidney disease and how it affects the African American population. Chronic kidney disease is when the kidneys are damaged and cannot filter blood properly. The loss of kidney function can cause a buildup of fluid in the body as well as waste. This can cause electrolyte imbalances. Depending on how severe the kidney function loss is will depend on how severe the symptoms are. The symptoms can range anywhere from nausea, vomiting, loss of appetite, excessive urination, or unable to void at all, itchiness of the skin, hypertension, shortness of breath, and chest pain. This can be caused by many things, including type 1 or type 2 diabetes, high blood pressure, and any sort of kidney infection, especially when they have been chronic.
When planning your nutritional goals to help with kidney disease, it's easy to forget about the importance of water. According to the National Institute of Health, regulating fluid is important because as the kidneys become more damaged, it is harder for them to remove any excess fluid. Additionally, if you're on dialysis, it's important to balance your fluid intake. If too much fluid builds up, it can cause an increased strain on the heart. This can worsen complications in patients who already have conditions such as hypertension or diabetes, both of which are common in the African American community. The National Kidney Foundation has some tips on how to be water wise to maintain healthy kidneys, such as less is more if you have kidney failure.
Adding fruits and vegetables to your diet is associated with lower risk of developing kidney disease and helps to manage risk factors for kidney disease like diabetes and high cholesterol. Fruits and vegetables like cauliflower, bell pepper, cabbage, garlic, onion, cranberries, blueberries, apples, and red grapes are very highly nutritious and contain antioxidants and vitamins that play an essential role in maintaining a healthy kidney.
It's also important to monitor potassium intake because kidney disease causes decreased excretion of urine, which puts people at risk for hyperkalemia, meaning too much potassium. Some might argue that potassium should be restricted in people with kidney disease due to the risk for hyperkalemia. But then, important foods such as fruits, vegetables, and grains will be removed from a person's diet. So it's important that foods with potassium are taken in moderation. Some foods to be aware of that contain potassium include bananas, avocados, tomatoes, and mushrooms. If symptoms such as numbness, tingling, muscle twitching, irregular pulse, or dysrhythmias occur, then hyperkalemia is most likely happening. If hyperkalemia occurs, then potassium intake should be limited to less than 3 grams per day.
Sodium, which you may know as salt, needs to be limited if you have chronic kidney disease. Too much salt in your diet can lead to fluid buildup, like swelling and puffiness, as well as high blood pressure. And if you're like many others, you already have more than enough sodium in your diet. So to limit the amount of sodium in your diet, you want to look for low sodium options and check the label for the total salt content. And when you're cooking, you want to use fresh ingredients or seasonings without added salt.
It also helps to know which foods contain the most phosphorus in them. Some of these include proteins like pork and seafood, nuts, oatmeal, sodas, dairy products, and anything with phosphate additives. If you have chronic kidney disease, it is best to try to limit or even avoid foods like these.
In chronic kidney disease, we are unable to produce vitamin D, which is an essential component in absorbing dietary calcium. Calcium plays a huge role in our body, including nerve conduction and the contraction of our muscles. So to maintain our calcium levels, we end up taking it from the bone. That causes a condition called renal osteodystrophy, which basically means that our skeletal structure has been compromised by our inability to absorb calcium from the food that we eat.
When you consume protein, your body produces waste that is filtered through the kidneys. It is important to not consume too much protein as it can cause a buildup in your blood, especially if your kidneys are not functioning properly. People with any stage of CKD who aren't on dialysis should limit their intake to 0.6 to 0.8 grams per kilogram of body weight to reduce disease progression. 2 to 3 ounces of lean meat or fish or skinless poultry can be consumed. Eggs, beans, lentils, and peas in a half a cup, nuts, 1/4 cup, and dairy products such as yogurt and milk in a half a cup.